Kustoff, you're recognized.
Thank you, Mr. Chairman. Thank you for holding today's hearing, and I do want to thank the witnesses also for appearing today. Mr. Fleece, if I could with you, in your opening testimony, you talked about the workforce shortages in the healthcare sector and how those shortages are affecting access to care. Can you tell me, in your experience, how common is it for somebody to enter the workforce as a CNA to pursue a higher level of nursing, like becoming a licensed practical nurse or registered nurse?
Thank you, Congressman Kustoff, for that great question. I will share, as the CEO of a hospice and home-based care organization that employs over 3,400 workers a day, that those healthcare workers are my first and foremost attention every day. And after the great resignation in healthcare that occurred during the pandemic, the runaway inflationary pressures that have hit healthcare since and going on forward since then, the pressures to hire, retain, and recruit staff are immense. We are absolutely reinvesting in workforce development as an organization at Empath, and certainly always very grateful for Congress's support for funding workforce development efforts. But it is a major healthcare crisis in the United States today. Across the entire system is adequate staffing in healthcare.
Thank you. Mr. Don Gilly, if I could with you, if a skilled nursing facility receives certain high-level deficiencies or a fine up to a certain dollar amount, as I understand, that facility probably can't offer or will not be able to offer CNA classes for a certain period. I think it's 2 years. So hypothetically, if Madonna were to lose that ability to hold CNA classes, how would that affect your ability to be able to staff your facility? How would you be affected?
Well, it would impact negatively our ability to have the CNA staff that we need in order to provide the patient care we're known for. So it's important, and we would hopefully not find ourselves in that position.
Sure. The district that I represent is a mostly rural district in West Tennessee. So in my district, there are a number of counties where the local nursing facility might be the only place that they could somebody could obtain or take CNA classes. So would you say it's fair to say that for a nursing home, maybe like the kind that I just described, that losing the ability to hold those CNA classes would inhibit or impair their ability to be able to improve the quality of service?
Yes, I would say it would.
Okay. Thank you very much. Dr. Madison, I know that Medicare reimbursement for remote patient monitoring services is subject to price modification based on average cost to operate in a given geographic area. Now, this takes into account factors like employees' wages, office space, equipment, and the cost of offering remote monitoring. Not necessarily cheaper in rural areas like the kind that I represent. And in fact, it might even present additional challenges like connectivity or broadband or longer travel times to set up equipment. Can you talk about how home health services like yours offer rural RPM if reimbursement for these services was in line with the national average? Does that make sense the way I asked that?
I can tell you as a home health agency that we're currently offering remote patient monitoring. We offered blood pressure, weight, and glucometers for our patients. We do not get reimbursed at all for those services currently, but we feel like it's necessary in order to provide better care, especially because we can see if there's an issue a lot faster. The devices that we use, we've not had trouble with connectivity. It's Bluetooth, and it's much easier than it was 10 years ago. Let me put it that way.
Good. Thank you, Dr. Madison. Thank you to the witnesses, and Mr. Chairman, I yield back.